Hello, and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on non-typhoidal Salmonella species under the section of infectious diseases. The epidemiology of this is that it is really not that common, and it is more surrounding sporadic cases. Sometimes outbreaks related to poor hygiene happen. These are usually secondary to contaminated food, poor kitchen and sanitary hygiene, and also contact with infected animals. The pathophysiology of it is that this is a gram-negative, facultative, anaerobic, rod-shaped bacteria. Salmonella enteritis and Salmonella typhimurium are the most common serotypes associated with human illness. Transmission primarily is through contaminated food and water, as previously mentioned, particularly in the cases of undercooked meat, eggs, and dairy products. The clinical manifestation, again, it can start as quite non-specific, such as feeling malaise, fever, and then it's pretty much following a case of gastroenteritis or food poisoning, which would manifest itself as abdominal pain, vomiting, and diarrhea. There are reports of invasive disease in which bacteremia can lead to metastatic infections, such as osteomyelitis, especially in vulnerable populations, such as the elderly and those who are immunocompromised. In very rare cases, it could potentially lead into infected aneurysm. The management of it is that luckily it's usually self-terminating and there isn't any requirement for any antibiotics. However, quinolones are recommended for invasive disease and especially in those who are immunocompromised. Growing issue of antibiotic resistance is obviously of concern, especially in those cases that would require antibiotic treatment. Let's do some questions. Question 1. A 25-year-old man presents to the emergency department with symptoms of fever, diarrhea, and abdominal cramps. He reports eating undercooked eggs at a brunch 2 days earlier. A stool sample is positive for Salmonella enteritis. Given the source and presentation, which of the following is the most appropriate course of action for managing his symptoms? A. Provide supportive care with oral rehydration salts and monitor closely. B. Prescribe oral ciprofloxacin. C. Administer intravenous fluid and recommend bed rest. D. Start intravenous ceftriaxone immediately. E. Prescribe oral metronidazole. If you recall, this is a case of Salmonella enteritis in a gentleman who is not elderly or immunocompromised as far as the history is concerned. Therefore, no antibiotic treatment is recommended, and you would be recommending him to have supportive care, which is oral rehydration salts and monitoring. Thanks for listening to this episode of Bite-Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.